Hello everyone, Dr. Perkins here, a board-certified OBGYN, and today we're talking about what is the treatment for ectopic pregnancies. So in this video today, we'll be talking about how common are ectopic pregnancies, who is most at risk for developing an ectopic pregnancy, are ectopic pregnancies dangerous, what are the associated risks with ectopic pregnancies, and of course, treatment options for ectopic pregnancy. So how common are ectopic pregnancies? You've probably heard about ectopic pregnancies being a huge risk factor to pregnancy and something that probably after pregnancy has occurred crosses your mind just to make sure that everything is okay. And especially if you start to have pain in your pelvic region, it just crosses your mind. Ectopic pregnancies actually affect 1 in 50 pregnancies in the United States. I've previously talked about what ectopic pregnancies are, describing where they're located. And so if you're interested in seeing that video, you can go ahead and check out the link right here. So in this video, we won't dive into what exactly they are, but we will talk much more in depth around the treatment options and knowing those risk factors. So who's at risk for developing an ectopic pregnancy? Well, in general, any birthing person who may get pregnant could develop an ectopic pregnancy. But there are definitely more risk factors that can be identified for people who may be at higher risk of developing ectopic pregnancies. And so we'll talk about that now. Research has shown that if your pregnancy is an in vitro fertilization or IVF pregnancy, you are at increased risk of getting an ectopic pregnancy. And while we don't quite understand why that is the case at this moment, we know that ectopic pregnancies may develop in people who may have had any kind of trauma, any kind of injury, or potential surgery to the pelvic region. Oftentimes, as you are undergoing infertility treatments, you may have procedures that come along with that, as well as diagnosed and undiagnosed reasons for having infertility. These factors overall may increase the likelihood of ectopic pregnancies happening. If you have a history of having any tubal surgery, meaning surgery to your fallopian tubes, you may be at increased risk as well. Any surgical procedures to your fallopian tubes may cause damage. Damage leads to having scar tissue or adhesions that may be built up inside of the tube exactly where egg and sperm needs to be fertilized. This damage could potentially prevent that egg and sperm conceptus from moving along the tube as it should. So the pregnancy develops inside of the fallopian tube, which is not the appropriate place for it to develop, mainly because the fallopian tube does not have the muscle, tissue, or blood supply that is necessary to maintain a pregnancy. If you've had a history of a previous ectopic pregnancy, you do have an increased risk of having another ectopic pregnancy. The risk is right now, per research, about 10%. We know that the reason and the cause for that first ectopic pregnancy is more than likely still present in your body and still a problem, and so that risk continues. And so if you have a history of a previous ectopic pregnancy, it is absolutely imperative that as soon as you know that you're pregnant, you follow up with your OBGYN immediately so that you can get the sonogram that is necessary to check to see where exactly that pregnancy is developing. Another risk factor is having a history of STDs. STDs encompass having gonorrhea, chlamydia, trichomonas, syphilis, HIV, or hepatitis. If you've had any of these in your history, then you're also at an increased risk of developing an ectopic pregnancy. And this is because STDs are known to cause damage, small adhesions and scar tissue in your fallopian tubes, as well as in your entire pelvic reproductive area. So that includes having damage inside the uterus, outside of the uterus, the cervix, the fallopian tubes, and even the ovaries as well. If you have a history of STDs, it is super important that you get treatment right away. The longer that these infections remain in your body, the more damage it may cause in the long run. And some of these damages you're not necessarily going to be aware of right away. You'll find out many years later when you're trying for pregnancy or when you develop an ectopic pregnancy. And so to protect your pelvic organs and your reproductive system, it's important that you complete treatment and also test after the treatment to make sure that you've been completely cured. Sometimes when you have a history of STDs, the infection may spread throughout your pelvic region and you may develop a different infection called pelvic inflammatory disease. This is where this infection has now taken over your pelvic region and takes really many antibiotics and many weeks of treatment to clear. The more infection you've had in your pelvis, the more scar tissue you potentially have on the inside, and the risk for having an ectopic pregnancy rises. The difficult part of knowing whether or not you have scarring or any history of damage to your pelvic region is that there are absolutely no tests or imaging studies that can be done to evaluate and check for scarring. The only way we can potentially know this is by visually seeing, either through laparoscopic surgery, where we take a look by putting a camera in your abdomen to take a look, or by things like an ectopic pregnancy that gives us the idea or gives us the thought that there's scarring and adhesions in your pelvic region. Lastly, I do want to mention that also having a history of endometriosis increases your risk of having an ectopic pregnancy. This is because endometriosis is an inflammatory disease. So whenever we have these glands and stroma and tissue that is very similar to that of the inside part of the uterus located around the pelvic organs and structures, the inflammatory changes in those regions leads to scarring and adhesions as well. This can be something that is predominantly found inside of the fallopian tubes, right where the egg and sperm needs to meet and right where fertilization occurs. If you have a history of endometriosis, it is very important just the same to evaluate your tubes, because we do have special testing to do that, as well as to know how severe your disease process is, and whenever you're planning for fertility, to speak to your doctor and plan for what if you were to have an ectopic pregnancy, so that you have a plan in place and you know exactly what to do. So many people have asked me, well, are ectopic pregnancies viable pregnancies? And the answer is no. If you have an ectopic pregnancy, that pregnancy needs to come to an end. There's no way to move the ectopic pregnancy to a safe place like inside of the uterus, and there's no other way for them to develop where they are. This becomes life-threatening for you and really can turn the corners and place you in a very dangerous state almost immediately. So if you know that you have an ectopic pregnancy, it is very important that treatment is started immediately. The wonderful thing about the medical treatments that we have available now in modern times is that we can survive ectopic pregnancies. Back in the past, people died of this on a daily basis. But now, as long as we intervene as soon as we can and treat the ectopic pregnancy, you're able to survive and not have long-term effects that could be pretty disabling. Outside of ectopic pregnancies being life-threatening, the next biggest risk is hemorrhaging. If you get to the point where you hemorrhage from an ectopic pregnancy, then what happens is that the bleeding internally can be so fast and so heavy that if you don't get immediate access to an operating room to surgically control the bleeding, you can easily not survive this ectopic pregnancy. Having an IUD or intrauterine device in place in your uterus also is a risk factor for developing an ectopic pregnancy. Research has shown that this risk increases by 1.6 times compared to someone without an IUD. So what are the treatments? Well, we can medically treat, which means that we give you medication, or we can surgically treat. There isn't an option to not treat at all, because not treating may be life-threatening. For medical treatment, this is not necessarily an option for everyone, but it could be for most people. The treatment of choice would be methotrexate, which is a chemotherapy drug, which is quite strong, but is quite effective. With this medication, you are given a dose the day that you're diagnosed, and you choose to go for this option. And with that, we check your hormone levels of pregnancy so that we can trend whether or not the treatment is being effective. Within 7 days of starting that methotrexate treatment, we will have a good idea whether or not the pregnancy is still developing, or be able to check to see if it has worsened or even started hemorrhaging internally. If you've already had some rupture or bleeding from this ectopic pregnancy, surgical treatment is really your only option. For surgical treatment, this means scheduling to go to the operating room so that we can remove the ectopic pregnancy from wherever it is developing, most commonly in the fallopian tube. In the past, we would surgically remove the pregnancy from the fallopian tube, leaving the fallopian tube remaining inside, and surgically repair that. In these times, we don't recommend removing the pregnancy and leaving the fallopian tube behind, because whenever we surgically operate on the fallopian tubes, we're increasing the likelihood of having another ectopic pregnancy. And so research has shown that multiple surgeries increases that risk, and the likelihood of having that ectopic pregnancy in the same exact location is so high that it's not worth keeping the fallopian tubes. And so because of that, most surgeons will remove the fallopian tube with the ectopic pregnancy. And so if this is your first tubal surgery, you'll still have one fallopian tube left to be able to get pregnant on your own. But again, know that if that tube that had the ectopic pregnancy had damage, and this was the cause of this ectopic pregnancy, the likelihood is the same that the other fallopian tube will have a similar damage. And so if pregnancy does occur on that other side, that is the reason why we want you to evaluate immediately to make sure that that ectopic pregnancy is not remaining in the fallopian tube, but has moved into the uterus where it needs to develop and continue on to develop a baby. If you've had 2 ectopic pregnancies that were surgically corrected, now the chances are you will not be able to get pregnant on your own. You may need infertility treatment, which would include IVF, to be able to successfully go through with a pregnancy. Can you get pregnant in the future after an ectopic pregnancy? Absolutely. Again, as long as you are working with your OBGYN, which I absolutely recommend that you do, immediate sonograms or ultrasound to locate the pregnancy would be your #1 go-to. With this, once you know that that pregnancy is developing right inside of the uterus where it should, then you're safe. But again, if an ectopic pregnancy has recurred, then treatment is needed by either medicine or surgery. I hope this information has been helpful for you. Thank you so much for being right here on my channel, for listening in and hopefully learning. I have a free gift for you. If you click the link below, I am offering you a free copy of my ebook, Hormones Don't Lie. In this, you'll learn so much about your female organs and hormones and how to optimize them so that you can live your best life. I love having these discussions and so much more right here on my channel. I'm Dr. Perkins, a board certified OBGYN. Talk to you soon.